out my big notebook that has all this stuff in it. I don't carry it around much. Okay. Personality disorder. Have y'all just done D2L testing? Y'all haven't done Scantrons? Well, in some aspects I miss Scantrons. Most of the time I don't, because D2L grades all this stuff for us. We used to have to run this through the Scantron machine, and it was a mess because it didn't work half the time. Okay. How are you going to deal with narcissistic people? We just said it. Cheerful, friendly, matter of fact, supportive. What are we going to do?
Matter of fact.
Matter of fact, that's right. Okay, upon admission, a patient with a personality disorder identified all the following as areas of concern for which the patient would like help. According to studies, which one of the following needs will most likely be addressed by the healthcare team? A, psychological distress, B, self-care, C, sexual expression, D, budgeting.
Yeah.
Carolyn. Carolyn says number 3. No, it's A, psychological distress. Think about it. If you're getting this patient, and that's one of the first things they're going to want to talk about is their psychological problems, right? We don't worry about self-care and sexual expression. Carolyn liked the sexual expression answer. She's shaking her head no. Okay, a female patient with borderline personality was formerly cooperative with the treatment regimen. Suddenly, she believes the staff has it out for her and is refusing all interaction and participation in treatment. The nurse feels very frustrated by this patient's behavior. Which of the following is the best action for the nurse to take regarding personal frustration with this patient? This is about the nurse now. A, discuss the feelings of frustration with the patient in a one-to-one interaction. B, discuss the frustration with a colleague or supervisor in a private setting. C, set aside the frustration and focus on reassessing the patient's needs. D, research the patient's diagnosis further to better understand these behaviors.
B.
Okay, B, discuss the frustration with a colleague or supervisor in a private setting. And that would be one of those little sessions after your shift. And you want to find out what's worked and what hasn't if you've got a patient that somebody else has also had. Because it's not one size fits all. Okay. When caring for a client with antisocial personality disorder, the nurse would include A, limit setting. B, taking only Tylenol for pain. C, effective problem-solving skills. D, A and B. E, A, and C. So I'll go through the ABC again. All right. A is limit setting. B is taking only Tylenol. Forget that one. C, effective problem solving. So what's it going to be?
A.
It's going to be A and C, okay? And that winds up being answered E. But you're going to have both, okay? You're going to have limit setting and effective problem solving. Okay. The staff meets weekly to discuss the care of a patient with antisocial personality disorder. Which of the following is the main reason why the periodic team meetings are important when caring for the patient? Select all that apply. Now, I told you all the other day you were not going to have any select all that apply, and you had to. I'm sorry about that. I've gone through these exams, I can't tell you how many times, and tried to throw out the matching and the select all, but that's what it is. Miss Manners still gives a lot of select all, doesn't she? Yeah. You're going to have them on the boards. you're going to have that. You're going to have a drag and drop thing where you highlight and the other is now they've added some calculating. I don't know if it's drug doses or whatever, but it's changing. It's changing. All right. So the staff meets weekly to discuss the care of a patient with antisocial personality disorder. Which of the following is the main reason why the periodic team meetings are important when caring for the patient? Select all that apply. Okay. A, they need to consider updating treatment recommendations as the patient improves. B, rotating team members need to be apprised of the care plan for the patient. C, staff frustrations in caring for the patient need to be processed. D, team consistency is important to prevent manipulation of the patient.
D.
Okay, so select all that apply.
Oh, that's a select all that apply.
Yeah. The need to consider updating the treatment recommendations may or may not be true. Rotating team members need to be apprised of the care planned for the treatment. That's probably true. But I didn't mark that one. Staff frustrations in caring for the patient need to be processed. Team consistency is important to prevent manipulation by the patient. All right, so this is what I put and the rationale I put it. I put A, C, and D. Okay, A is the updating the treatment plan. C is staff frustrations need to be processed. And D is team consistency is important to prevent manipulation. So those are the three that I chose. I didn't pick B, rotating team members. Thought that was kind of loose. All right, so the rationale is the client may try to manipulate staff members or focus attention on others to decrease attention to himself. What does everybody think? That's a bad question, is my opinion. It's a bad question because all of them are true. Now, they have told me that the way the boards look at it now, in a select all, you can have one, all, whatever, everything in between. I have not done it that way. Okay, number 6. Patient with borderline personality disorder says to the nurse, I feel so comfortable talking with you. You seem to have a special way about you that really helps me. The most appropriate response by the nurse would be, A, I'm glad you feel comfortable with me. B, I'm here to help you just as all the staff is. C, you feel others don't understand you. Or D, I cannot be your friend. We need to be clear on that. So what do you think?
B.
B. It's B. I'm here to help you just as all the staff is. And the rationale is these clients manipulate and exploit those around them. So that would cut down on the manipulation. Realistic outcomes for the care of a person with a personality disorder include which of the following? A, outcomes which focus on satisfaction with daily life. B, outcomes which focus on patients' perception of others. C, outcomes which focus on increased patient insight. Or D, outcomes which focus on change in behavior.
A.
It's D, yes. Marilia got it. Change in behavior is the goal for these patients, but may take years to accomplish. So teaching them a better way to behave, right? Or react. All right. The nurse teaches an antisocial patient to take a timeout in his room when challenged by another person instigating an argument. The main reason for the timeout is which of the following? A, it allows time for the instigator to leave the area. B, it allows adequate space between the patient and the instigating individual. C, it prevents the patient from experiencing negative consequences or behavior. And D, it allows an opportunity for the patient to regain control of emotions.
D.
It's D. You're right. Rationale. Timeouts help clients to avoid impulsive reactions and angry outbursts in emotionally charged situations and regain control of emotions. So that getting control is the thing. Oh, I forgot to tell you at the beginning of this. This exam is 100 questions, so you're only going to have 50. But I'm going to go through all of them because I don't know which one's going to come up. The purpose of D2L is to shuffle things so that you don't get the same question as the person next to you. And so when y'all tell me that you had a problem with a question and I go through the exam that you took and it's not there, that's the reason. It's because it's pulling these questions from that question pool of 100 questions. Okay? All right. The nurse is teaching a patient with paranoid personality disorder to validate ideas with another person before taking action on them. Which of the following is the best rationale for this intervention? A, it will assist them to start basing decisions and actions on reality. B, it will help them understand the origins of their paranoid thinking. C, it will help them learn to trust other people. D, it will teach them to differentiate when their suspicions are true. I got an A up here. Okay, that's the right answer. It will assist them to start basing decisions and actions on reality. Okay, when working with a client with a personality disorder, the nurse would expect to assess all of the following except impaired interpersonal relationships, inability to empathize with others, minimal insight, motivation to change. When working with a client with a personality disorder, the nurse would expect to assess all of the following except
motivation change.
Yes, motivation to change. Personality is an ingrained, this is the rationale. Personality is an ingrained, enduring pattern of behaving and relating to self, others, and the environment, and do not change easily. So that motivation to change is not going to be your answer. I mean, that's going to be your answer because it's the accept part. A patient with antisocial personality disorder is begging to use the phone to call his wife, even though it is against the unit rules. The patient begs, it is just this once, and she will be so hurt if I don't call her. An appropriate response by the nurse would be, A, only to help your wife, you can call this one time. B, I'll get in trouble with my supervisor if I let you call. C, you may not use the phone to call your wife. D, you cannot call because you need to focus on your recovery while you are here, not your wife. Mm-hmm. Three. It's three. You may not use the phone to call your wife. This is antisocial. Got to draw the line in the sand. Got to tell them what's what, right? The rationale says that the nurse must set limits stating behavioral limits, consequences, and expected or desired behavior. Remember those three things that we talked about in your book? So you got to state the behavioral limits, the consequences, and expected or desired behavior. Okay, number 12. A nurse is caring for a client with paranoid personality disorder. The nurse would expect to observe which of the following conditions: A, exhibitionism, B, impulsiveness, C, secretiveness, D, self-destructiveness. Carolyn's got it. It's 3, okay? Secretiveness. They're going to be suspicious of everything, so they're going to be over here being secretive, Okay. Cognitive restructuring techniques include all of the following except. I have to tell you that on the board, you're not going to see any except questions. And the reasoning is they're giving you the answer to the question with your options. Okay, so you won't see, you're going to see it on our exams, but not on the boards. All right, so cognitive restructuring techniques include all the following except. All right, so A is decatastrophizing, B is positive self-talk, C is reframing, and D is relaxation. It's number 4. Okay, relaxation is not part of it, although they might include that, but that's not one of the rules. All right, D, the nurse is working with a client with antisocial personality disorder. This client's desire to do everything for himself is based on which of the following? A, belief in his own self-worth. B, inability to delay gratification. C, rewards for competitive behavior. D, a sense of mistrust of others. That's right. Kayla's got it. It's number 2, inability to delay gratification. So he wants to do everything for himself so he can get it done, right? Number 15, in response to a client's manipulative behavior, the nurse should provide A, consistent limits, B, feedback about behavior, C, reasonable punishment, D, relaxation exercises. It's number 1, consistent limits. Yeah, some of you got it. A lot of you got it. Do you want to do the true and false? Okay. All right. Dissociation is a defense mechanism used to protect the person from memory of some traumatic event. True or false? 1 is true, 2 is false. Okay. So that's true. All patients with personality disorders are treated in group therapy. It's false, right? What makes that false? What should be your first clue? Is when it says all. Exactly. People with obsessive compulsive personality disorder may undermine the success of a group by not getting their part done on time. True. True. It's never right. So their part's never right, and they don't want to turn it in or whatever. So be careful with groups. Unfortunately, we don't get to do group things with virtual learning, or I don't know how to do it. I don't know if Miss Manners does any group stuff or not. Does she? Any group activities, any group? I'm sure it could be done. It's just not in my wheelhouse, as the saying goes. All right. Lithium is used to treat all personality disorders. The word all, okay. So if you look back at that chart and it gives you the symptoms and the medications, that's probably where you would find that. Lithium is not all. It treats a lot of them, but not all. Okay. Sorry. Frequent assessments are necessary for patients taking antipsychotics long term because dosage adjustments may be necessary. True. They have that narrow range, and they're going to have to be manipulated frequently simply because of the salt receptor sites and the amount of salt in the diet. Okay. Sedatives and hypnotics are not controlled substances. That's false. It's kind of worded backwardly, but you need to be able to pick that out. All right. Anti-anxiety drugs should not be discontinued abruptly. It's true. Personality is an ingrained, enduring pattern of behaving and relating to self and others, including perceptions, attitudes, and emotions. True. It's true. So when I said those definitions and make your cards, this is one of them, okay? Personality disorders are diagnosed when traits become inflexible and maladaptive and interfere with function in society. True. That's true. People with personality disorders often change their behavior when the behavior causes them difficulties. They don't change. They don't change. Okay. I think I left the true and false in, I just took out the matching. And sometimes the select all. All right, when assessing a client with narcissistic personality disorder, the nurse would expect the client to demonstrate which of the following? A, genuine concern for others. B, mistrust of others. C, grandiose and superior self-concept. D, dependence on others for decision making.
D.
It's 3, yeah. Grandiose and superior self-concept. Okay, when planning care for a client with passive-aggressive personality disorder, the nurse will need to include interventions for which of the following behaviors? A, avoidance of anxiety-provoking situations. B, compulsive needs for perfection and praise. C, dependence on others for decisions. D, procrastination and intentional inefficiency.
Okay.
It's the last one, procrastination and intentional inefficiency. So the rationale is they have a negative attitude and a pervasive pattern of passive resistance to demands for adequate social and occupational performance. So go back. It's just a paragraph. Go back and see if you can find that. I know I took this rationale right from the book. So procrastination and intentional inefficiency. That sets up somebody else and I don't lecture that way, so you need to get this in your mind, okay? But go back and look at that paragraph. It's in there somewhere. I promise it's in there. All right, so studies of families, twins, and relatives of persons with personality disorders have demonstrated that the developing personality is influenced by genetics, income, birth order, government. It's number 1, genetics. And so if you look at the question, when Ms. McBride was giving you the decision tree, you have to look at the question, right? And when I said, if you get it down to 2 answers or whatever, go back and read the question. So this is telling you, it says families, twins, relatives. So that should indicate that it's genetics, right? Or that's the way I think of it. Rationale, there are 4 temperament traits and genetics account for 50% of the differences. That's the rationale. Okay, Sam assumes that everyone is out to harm, deceive, or exploit him. He often feels deeply injured by others, even when no evidence exists. His behavior indicates A, paranoia, B, schizophrenia, C, normal behavior, or D, OCD. It's number 1, right? Paranoia. D, the childhood trait that increases the risk for developing an antisocial personality disorder is poor school performance, practicing reading skills, poor impulse control, or B, or both A and C. So A and C are poor school performance, practicing reading skills, poor impulse control. Number 4, both A and C, poor school performance, poor impulse control. I don't know about the poor school performance. That makes sense to me. The rationale says the child is expected to develop the ability to delay gratification and socially acceptable behavior as they develop. So it doesn't say anything other than the poor impulse control. This delayed gratification. But I can see how you would choose the poor school performance because part of the protective factors is a good school and all of that. So I do see that.
So the answer wasn't the last one?
Yeah.
Okay, so what's four? Or B, D, or whatever?
Yeah, the poor school performance and poor impulse control.
Okay, thank you, ma'am.
Just because the school performance is part of those protective factors of a good school, a good neighborhood, a good whatever. Okay, which of the following interventions should the nurse include in a plan of care for a client with histrionic personality disorder? A, accept the client's behavior. B, assist the client to eliminate passive behavior. C, set limits on attention-seeking behavior. Or D, try to meet the client's needs for attention. It's C, set limits on attention-seeking behavior. The rationale says feedback should focus on appropriate alternatives, not merely criticism. Okay. All right. When interviewing, I'll get this right in a minute. When interviewing any client with a personality disorder, the nurse would assess for which of the following? A, ability to charm and manipulate people. B, disruption in some aspects of his or her life. C, desire for interpersonal relationships. D, increased need for approval from others.
B.
It's B, the disruptive factors, right? What are those three things? What are the disruptions in? A, job. B, family. C, legal system. It's going to happen. Okay. The nurse would assess for which of the following characteristics in a client with narcissistic personality disorder. Oh, this is a duplicate. A, entitlement. B, fear of abandonment. C, hypersensitivity. D, suspiciousness. It's not the exact same answer, but entitlement is the answer to that question. I mean, the options are not exactly the same in the other question. Rationale, the narcissistic patient feels entitled and lacks empathy and has a need for admiration. D, which characteristic of a client with a paranoid personality disorder makes it difficult for a nurse to establish an interpersonal relationship? A, dysphoria. B, hypervigilance. C, indifference. D, promiscuity. It's 2, hypervigilance, right? They think everybody's out to get them. Rationale, paranoid patients are guarded and suspicious of others. All right. A patient has frequent suspicious reactions to peers on the unit. As a result, others do not include him in conversation and activities. The nurse would report that the patient is displaying behaviors associated with which personality disorder? I bet you can tell me. Just tell me. I won't read you your options.
Is it paranoid?
Yeah, paranoid. They've gone away from the patient. They've eliminated relationships and activities. I think he's going to think every time they talk to each other or their nurse, the paranoid patient's going to believe it's about him. All right. The personality disorder characterized by excessive emotionality and attention seeking is known as A, narcissistic. B, schizoid. C, depressive behavior disorder. Or D, histrionic personality disorder. It's histrionic. You're right. Temperament is the biologic process of A, hard work and honesty. B, personality and affect. C, self-survival. D, sensation, association, and motivation. So it's D. And if you made your little cards up, that would be on your card. Mary Lee is holding up her card. Okay, so she did make a card. Anybody else? No. You should. All right, so the staff notices that 80-year-old Elizabeth's behavior is beginning to change from outgoing and talkative to sullen and sitting in her chair. Investigation of Elizabeth's personality change is based on the premise that A, more activities should be planned for the elderly. B, a change in personality is a normal sign of aging. C, a change in personality indicates that death is near. D, anger, loss, and sadness in older adults is often unexpressed. It's D, you're right. And the rationale is elderly patients are unable or unwilling to acknowledge limitations, refuse to accept help, and do not make reasonable decisions, all of which make the patient have these symptoms. So they have a hard time accepting it, right? I had a corrected typo here. Okay. Which behavior by a client with antisocial personality disorder alerts a nurse to the need for teaching related to interaction skills? All right. A, frequent crying. B, panic attacks. C, avoidance of social activities. Or D, failure to follow social norms. I got a 3 up here. I got a D, 2 D's, okay. Failure to follow social norms. And the rationale is antisocial clients fail to see that rules apply to them and they have no respect for others' rights. So failure to follow social norms, meaning what would everybody else do, though? The school of thought that views personality disorders as the result of conditioned responses caused by previous events is A, behavioral theory, B, biologic theory, C, sociocultural theory, D, psychoanalytic theory. Let me read the question again. The school of thought that views personality disorders as the result of conditioned responses caused by previous events is behavioral, biological, sociocultural, psychoanalytical. Number 1, behavioral theory. All right. Stephanie is unable to make decisions by herself. She clings to her husband and quickly moves to fill his request. Although she appears angry sometimes, her emotions are not expressed. Stephanie's diagnosis would be A, neurotic personality disorder, B, dependent personality disorder, C, paranoid personality disorder, or D, borderline. 2, we got 2. Dependent, yep. That one's an easy one. I shouldn't even give you that question. Too easy. Just kidding. You gotta have an easy one every now and then, don't you? So the rationale is these patients perceive themselves as unable to function outside a relationship with someone who can tell them what to do. A female patient who suffers from a histrionic personality disorder would most likely engage in which of the following? A, insisting that others follow the rules of the unit. B, wondering why others are being friendly. C, having a tantrum if not getting enough attention. Or D, getting others to make decisions for her. C, you're right. Teams doesn't let me see all of you at once. I just get to see about 6 of you. All right, rationale. Histrionic patients are characterized by a pervasive pattern of excessive emotionality and attention seeking. Okay, a nursing student is elected leader of a group project because she always stays up half the night making sure every detail of an assignment is perfect. However, the student is never fully satisfied with her work and is making changes up until the deadline. a nursing student may be showing signs of which personality disorder? Paranoid, borderline, narcissistic, obsessive compulsive. It's the last one. And the rationale, these patients have a preoccupation with perfectionism, mental and interpersonal control, and orderliness at the expense of flexibility, openness, and efficiency. It seems like you would want that person on your team, but it is just excessive. All right, some theories propose that temperament is associated with personality disorders. A person with temperament traits of high harm avoidance would most likely suffer from which personality disorder? A, schizoid, B, avoidant, C, narcissistic, D, antisocial. High harm avoidance. Number 2, avoidant personality disorder. So the high harm avoidance should have tipped you off, right? All right. And the rationale is avoidant personalities are characterized by a pervasive pattern of social discomfort and reticence, low self-esteem, and hypersensitivity to negative evaluation. Which of the following terms describes the extent to which a person considers himself to be an integral part of the universe? Your card would have helped you. Cooperativeness, self-directedness, self-transcendence, and character. Number 3, self-transcendence. You're part of the universe. You're part of the big picture. Okay, which of the following is a psychosocial explanation for the development of personality disorders? A, highly self-directed people reflecting cooperativeness and intolerance. B, cooperative people become increasingly helpless over time. C, failure to complete a developmental task jeopardizes future personality development. And D, self-transcendence contributes to self-consciousness and materialism. So what you got? C, failure to complete a developmental task jeopardizes future personality development. And the rationale is Maslow's hierarchy. That's the rationale. When working with a client with a narcissistic personality disorder, the nurse would use which of the following approaches? Cheerful, friendly, matter-of-fact, supportive.
Matter of fact.
Matter of fact, you got it. The rationale, this approach sets limits on rude or verbally abusive behavior and explains his or her expectations of the client. So that's going to give you those 3 things, right? The behavior, the expectations, and what part of it was wrong. All right, all of the following are character traits except, okay, character traits except self-directedness, cooperativeness, poor hygiene, self-transcendence. Character traits, number 3, poor hygiene. Has nothing to do with all that. Okay.
Ms. White, could you please
Yes.
repeat that
Yeah.
one?
I will. All of the following are character traits except, and we've got self-directedness, cooperativeness, poor hygiene, and self-transcendence. So poor hygiene is not a character trait. That's just VO. I don't know.
Thank you. My computer had cut out, so I didn't hear what you said. Thank you.
Didn't hear it. Okay, people in high reward dependence are sensitive, sociable, and socially dependent, inactive, indolent, unstable, positive thinkers, not awake, alert, and oriented. So if you're dependent on that reward, okay, sensitive, sociable, and socially dependent. Okay, so if you need that reward system, that reward dependence, okay, you're going to be sensitive and sociable and socially dependent. If you're low in it, what are you going to get? You don't need that reward dependence, so it's all about you and who cares, right? Okay, personality disorders are relatively common, occurring in, this is a number question, okay? 40 to 50% of the general population, 60 to 70%, 10 to 20%, or 0 to 5%. Marilee is waiting for me to Okay, so the answer is 10 to 20% of the general population. So when they say it's relatively common, relatively common's not going to be those 60, 70%. Okay? That's way too high. That would be pervasive, not just relatively common. People with high harm avoidance exhibit A, fear of uncertainty, social inhibition, shyness with strangers. B, high self-esteem, good organizational skills. C, excellent personal communication skills. Or D, competence in math and science. It's number 1, fear of uncertainty, social inhibition, shyness with strangers. So if you compare that one to the one with high reward dependence, right? This one is high harm avoidance. So it shows you the positive and the negative. So when you're taking these exams, you need to kind of think about opposites, right? During a family meeting for a client with an antisocial personality disorder, which statement is expected from an exasperated family member? A, today I'm the enemy, but tomorrow I'll be a saint to him. B, when he's wrong, he never apologizes or even acts sorry. C, sometimes I can't believe how he exaggerates about everything. D, there are times when his paranoia is too much to handle. The answer, y'all are all over the place. The answer is B, when he's wrong, he never apologizes or even acts sorry. That's the antisocial guy. Doesn't care about anybody else. And the rationale. Antisocial personality disorder is characterized by a pervasive pattern of disregard for and violation of the rights of others, with a central characteristic of deceit and manipulation. They have a lack of remorse for any wrongdoing. Okay? That lack of remorse describes that patient to a T. Okay. Dependent personality disorder is characterized by demands for adequate social performance, excessive need to be taken care of, independence and self-assuredness, and D, need for flexible relationships. So it's B. Good. We've all got that one. Psychotropic medications are prescribed for clients with personality disorders based on A, the severity of crying outbursts, B, number of arrests for fighting, C, severity of symptoms resulting in aggression and impulsivity, or D, the number of attempted suicides. It's C, severity of symptoms. That's it. Okay, I have a matching that won't be on your exam, but this is easy. It's the description of each disorder. Chronic social withdrawal, feelings of inferiority. What would that be? Avoiding social situations. What are we talking about?
Antisocial.
Avoidant personality. Okay. B, odd and unusual magical beliefs. That's schizotypal. It's that magical thinking thing. Emotionally distant and prefer to be alone. Schizoid. Schizoid personality. Pervasive fear of abandonment, unstable relationships. Borderline. Suspiciousness and deep mistrust of people. Paranoid. Okay, so you may be required to pick those out, but we're not going to have them matching. Okay, matching really messes up the grading on D2L. That's why I take those out. It's not that you don't need that information. It's just that it messes up the grading. It messes up the number of questions, and that's multiple choice does that too. All right. A client is suspected of having antisocial personality disorder. Which finding would most support this diagnosis? The client has delusional thinking. B, the client has feelings of inferiority. C, the client has disorganized thinking. Or D, the client has multiple criminal charges. Antisocial.
Multi-criminal charges.
That's it. They're going to be in trouble. They've already been through the job and the family. Now they're to the legal system.
Wait.
And yes.
Oh, I just have a question real quick, or just clarification. Antisocial, I mean, I used to think of it as people that just pushed other people away. They did not want to be social, but it is more that they're combative and it's like not play well with others kind of idea, right?
Well, they have that feeling of not taking responsibility for their actions and a total disregard for everybody else's feelings or the results. Does that make sense? Yeah, antisocial sounds like withdrawal or whatever, but that's not it. Okay, which assessment finding is seen in a client diagnosed with borderline personality disorder? A, superficial injuries in various stages of healing. Intermittent episodes of hypertension. C, alternating tachycardia and bradycardia. And D, mild state of euphoria and disorientation. So are they hurting themselves? It's number one, right? So superficial injuries in various stages of healing. That's your borderline, okay? Self-injury. Okay, Dilatin, phenobarbital, and Tegretol are used to treat personality disorders. They fall into which of the following categories? So what type, okay? Antipsychotics, benzodiazepines, anticonvulsant mood stabilizers, or D, MAOIs. Mood stabilizers. Anticonvulsant mood stabilizers. That's the category, okay? And I think that's on that little chart where we talked about symptoms and the medications. Be sure to check that out. Yeah, they're all seizure medications. And the point of seizure medications is to get that threshold down for all that electrical activity going on in the brain. Clients with borderline personality disorder often have urges for A, self-control, B, self-harm, C, self-absorption, D, self-consciousness. It's B, self-harm. Okay, borderline is that reason for that self-harm. Characterized by unstable interpersonal relationships, self-image, and affect, as well as marked impulsivity. That's a quote from your book. All right. People with personality disorders have traits that are flexible and adaptive and cause no significant functional impairment or distress. Is that true or false? False. People with personality disorders are inflexible and maladaptive, which cause themselves problems as well as for those around them. That's the rationale. All right, another true false. Nurses must use self-awareness skills to minimize client manipulation and deal with feelings of frustration. True. Children who have a greater number of protective factors are more likely to develop antisocial behavior as adults. That's false. Good. And the rationale, protective factors are good. Family, friends, neighborhoods, church affiliations, all of which help protect children from antisocial behavior. When planning care for an individual with borderline personality disorder, nurses realize that the patient, A, will not be able to make decisions, B, will expect special treatment, C, will act out when feeling afraid or disrespected, D, will withdraw and become uncommunicative. It's C, will act out when feeling afraid or disrespected. And the rationale is their labile moods make it difficult to help them. They cling and ask for help 1 minute and then become angry, act out, and reject all offers of help in the next minute. So their mood is labile. You don't know what you're getting. An antidepressant, Prozac, has been prescribed for your patient. Patient education would include which of the following? A, slowly increase your dose until all symptoms of depression are relieved. Avoid drinking too much water. Do not drink alcohol while taking this medication. Avoid exercise during the first hour after taking any medications. 3, do not drink alcohol while taking this medication. Okay. Rationale, drinking alcohol while taking psychotropic medications can cause serious, if not fatal, interactions. I'm correcting a typo, sorry. Okay. The nurse working with a client with antisocial personality disorder would expect all of the following behaviors except compliance with expectations and rules, exploitation of other clients, evoking sympathy by sadly relating a story of his terrible childhood, D, withdrawal from social activities. It's 1, compliance with expectations and rules. They're not. Okay, true or false? Major causes of personality disorders are neurochemical imbalance and genetics. True. Okay, Stan is a 25-year-old patient being treated at your hospital day treatment center. He's very charming and seems popular. He has the ability to draw crowds around him, but you know he has been in trouble with the law several times and lies constantly. You realize Stan's behavior is indicative of A, paranoid personality disorder, B, schizoid personality disorder, C, dependent personality disorder, D, antisocial personality disorder. It's D, antisocial. He's been in trouble with the law several times. He's charming. He has the ability to draw the crowds. Yeah. Which of the following would characterize a client with histrionic personality disorder? A, introverted and withdrawn. B, a pattern of grandiosity. C, excessive emotionality and attention seeking. D, unstable interpersonal relationship, self-image, and affect. Is C. Mary Leah's on it this morning. All right. Your 18-year-old patient was caught and jailed for vandalism. His father requested a mental health evaluation and explained he is a sociopath What other symptoms of antisocial personality disorder would you expect to find? A, difficulty keeping a job and making friends. B, common predictable behavior. Quiet and isolated behavior, or purposeful inefficiency. It's A, difficulty keeping a job and making friends. And when the father says he is a sociopath, remember that little sentence that it used to be named sociopathy or psycho whatever. Which condition is most likely to coexist in clients with a diagnosis of borderline personality disorder? A, avoidance, B, delirium, C, disorientation, or D, depression? Remember, they have labile moods, right? Remember that it's closely linked to depression for suicidal ideation. So that's your key. The rationale, the pervasive mood is dysphoric, involving unhappiness. I have more typographical errors in there. Involving unhappiness, restlessness, and malaise. Clients often report intense loneliness, boredom, frustration, and feeling empty. So those are descriptions of depression, actually. All right. The clinical picture of depressive personality disorder include A, happy euphoric mood, B, sad, gloomy, or dejected affect, C, outgoing and personable demeanor, D, increased appetite, great interest in activities. So it's B, right? Sad, gloomy, or dejected affect. So the name of this disorder in itself, depressive personality disorder, should give you that information. All right. Obsessive compulsive disorder is characterized by a pervasive pattern of low self-esteem, methodical attention to detail, preoccupation with perfectionism, D, all of the above. It's D, all of the above. All right, narcissistic personality disorder is characterized by A, excessive hopelessness, B, caring concern for others, C, need for admiration and lack of empathy for others, D, disheveled clothing and poor hygiene. So it's 3, need for admiration and lack of empathy for others. And that sets them apart from the histrionic, okay? All right, so I've got another matching section. I'm just going to read these off to you. So the first one is borderline, and the answer is emotional with unstable identity and relationships, feared abandonment. So the abandonment should give you the clue to borderline, okay? Fear of abandonment. Narcissistic, arrogant with grandiose views of self-importance and need for admiration. OCD is perfectionist and orderly, perfectionistic and orderly, demands control of the situation. That's OCD. And dependent is submissive and clinging, need to be taken care of. If you miss that one, I'll shoot you. Just a little bit. I'll just shoot you a little bit, okay? Not a lot, just a little.
With no gun, right?
Yeah. You can have a squirt gun, you know. Oh, listen, there are a lot of opponents to that one even. Okay.
I could buy you a Nerf gun.
Oh, that would be good. Yeah. Except you lose those little things when you know, I used to have them all over my house. My grandchildren had them. And guess who bought them? Yeah, I know. My son said one time, "What happened to you? You never let us do all that stuff." I said, "Well, that's what grandparents get to do." All right, when a client has borderline personality disorders asks his roommate to play a card game with him, and the roommate agrees. The client says, "You are my very best friend in this place." Later, the client asks the roommate if he can borrow his magazine, and the roommate says, "Not until I finish reading it myself." The client says, "I hate you. You're so evil for not sharing." This is an example of A, regression, B, splitting, C, undoing, D, identification. Splitting. Labile moods accompany borderline disorder, and splitting is common. So that's that one end of the spectrum to the other. They hate you, they love you, one of the two. A client who has antisocial personality disorder is admitted to a chemical dependency unit. The nurse should be alert for all of the following characteristic behaviors except, all right, this is antisocial. A, submissive. B, exploitative. C, deceptive. D, irresponsible. I'm getting wrong answers. Okay, the answer is A, submissive. Except, the word except is at the end of the question. Y'all didn't listen. Students miss a lot of except questions. Yeah, I know. They quit reading. Okay. It's like I said, you pick out those words you know, and that'll make you pick the wrong answer. So you have to read the whole question, even the word except. Even that one. Okay, the client with borderline personality disorder will be A, impulsive and unpredictable. B, self-damaging, risky behavior. C, appropriate and pleasant. And D is A and C, E is A and B. So you got two in there, right? A and C, impulsive and unpredictable, appropriate and self-damaging, risky behavior. So it's A and B. All right? They're not going to be appropriate and pleasant most of the time. Okay. The nurse admits a patient with a passive-aggressive personality diagnosis. Which of the following would she expect to find? Complaining and blaming behavior, completing tasks as requested, feeling on top of the world, increased hand washing. So it's A. Complaining and blaming. Kayla, you look like you're having a terrible morning. I see you all covered up in your blanket.
I am tired. The morning's okay. I'm just tired. I was up a little late with the baby.
Oh, okay. Oh, that explains it. Did she get up early too? No. Is she still asleep?
Yeah, she's still asleep. Yeah, she went to sleep late, so she'll probably be up about 30 minutes.
Okay. All right. So the rationale with the passive-aggressive, characterized by a negative attitude and a pervasive pattern of passive resistance to demands for adequate social and occupational performance. It's that passive resistance. Which approach should be used with a client with paranoid personality disorder who misinterprets many things the healthcare team says? A, limit interaction to activities of daily living. B, address only problems and causes of distress. C, explore anxious situations and offer reassurance. D, speak in simple messages without details. Paranoid. We got C, explores anxious situations and offer reassurance. So we're going to ask him about what's making him anxious. Okay, that's explore anxious situations and offer reassurance. Okay. Oh, we got more matching. What have I got? All right. Antisocial personality disorder, manipulative, irresponsible, no remorse. There. Oh, yeah, antisocial. Got it, sorry. Histrionic personality disorder, persistent attention-seeking behavior. Narcissistic personality disorder, grandiose opinion of self. And obsessive compulsive disorder, preoccupation with perfectionism. Those are all easy. All right, here we go with numbers. Y'all might have to count on your fingers, okay? A physician prescribes 25 milligrams of chlordiazepoxide, I don't know what that is, orally 4 times a day for a patient. The drug is available in 10 milligram tablets. How many tablets will a nurse administer the patient daily? So you've got 4 times the dose, and that's 100 milligrams, right? And so you've got 10 tablets, that's right. And you should be able to do that in your head. You don't need a calculator. Everybody screams, we don't have a calculator. So 10 is the answer. All right. A physician prescribes 0.25 milligrams of clozapam, I can never say that, every 12 hours for the first 3 days, okay? How many milligrams of the drug will the nurse administer the patient over 3 days? All right, so you got 0.25 milligrams every 12 hours, so that would be 6 doses. You got 3 days, 6 doses. How many milligrams of the drug will the nurse administer the patient over 3 days? 1.5. Yep, 1.5. A patient has been prescribed 150 milligrams of doxepin hydrochloride daily. The drug is available in 25 milligram tablets. How many tablets are needed daily to meet the prescribed drug level? So we got 25 milligram tablets. You divide 25 into 150, right? And you get 6 tablets. Easy peasy. A client with a paranoid personality disorder tells a nurse that another nurse is out to get him. Which action by the nurse may cause distress for this paranoid client? A, giving as needed medications to another client. Taking the clients outside the unit for exercise. C, checking vital signs of each person on the unit. D, talking to another client in the corner of the lounge. It's number 4. They're going to think, that paranoid patient's going to think they're talking about him, right? Okay. Which behavior by a client with antisocial personality disorder alerts a nurse to the need for teaching related to interaction skills? A, frequent crying. B, panic attacks. C, failure to follow social norms. D, avoidance of social activities. So it's 3, failure to follow social norms. We had that in another question worded a little differently, but they're not going to go by the rules, and that's basically what that means. The primary health care provider has diagnosed the patient with anxiety due to withdrawal from alcohol. Which of the following should the nurse expect to find? Diarrhea, acute panic, dry mouth, lightheadedness, or E, A and B? It's the last one because it's A and B, okay? Diarrhea and acute panic. Which of the following medications is categorized as selective serotonin reuptake inhibitor? A, Zoloft, B, Sinequan, C, Ativan, or D, Topranil? Zoloft. It's A, Zoloft. Which of the following is classified as an anxiolytic? Artane, Buspar, Inderal, or lorazepam? Has Ms. Manners gone into the suffixes of medications? So anything with a PAM on the end, okay? So anti-anxiety drugs, and it would be A, anxiolytics. Oh, I'm on the wrong question. Which of the following is classified as an anxiolytic? And the answer is lorazepam, which is Ativan or whatever. Is it Ativan? Okay. Anti-anxiety drugs are also referred to as which of the following? A, anxiolytics, B, opioids, C, NSAIDs, or D, diuretics. So it's anxiolytics. That's it. Okay. You all passed. Sort of. Sort of. What time do I get through today? Is it 10:30 or 11:30?
It's 10:30 today.
Okay, good.